best ways to keep a youthful smile and to make it look brighter is to do exactly what Joanne Hopkins did with some cutting-edge technology. Here with more is Christopher Hopkins, makeover guy Christopher Hopkins, along with his beautiful mother Joanne and dentist Steve Gorman. Welcome to all of you.
Thank you.
Well, I've waited years for this moment. This is a segment where you are practically a phantom in this, but you're here, Christopher, to say, what about mother?
I'm basically here because I wanted to offer the viewers, of course, of the many makeover things. One of the things you can do and that really makes a difference is as you age, your teeth get yellow and all sorts of things, and how you can do a brighter smile. And I wanted to use my mom. And
Joanne, your concern was you wanted a natural look. You didn't want that fake chopper look.
Absolutely. I love the natural so that when someone looks at you, they don't say, oh, she just had her teeth done. And I think Dr. Gorman has accomplished that.
Well, very good. You deal with, and as you consult with so many different people, when Joanne sat down in your chair, what are you looking at? What's involved in an evaluation, Dr. Gorman?
Well, I think the first and most important thing is just to listen, and listen to what Joanne is interested in. And, you know, she came in and she had a definite idea of what she didn't like, and I think that's as important as anything. And then to really spend some time with her, to up front, kind of slowly, to ask, where would you like to be, and give her some options and those kinds of things, and then get into, you know, the meat and potatoes of getting the information we need to be able to put it together for her.
What types of different procedures are available?
Well, there's everything from, you know, just whitening teeth to full mouth reconstruction and everything in between. So it really depends on the exact situation, what the patient's desires are. And we look at function and aesthetics, and all those things are important when we decide which route we're going to go.
I've heard of there's porcelain veneers, and there's composite veneers. There's all name off the different things.
Yeah, there's a myriad of options. There's, besides whitening, a composite veneer. Composite is a material that is kind of a putty material that you can apply to teeth and bond to the teeth and shape and colorize. Porcelain is made in the laboratory, and is the state-of-the-art way to go is with porcelain these days.
And do they last longer then?
They do.
And they cost more.
They cost more, and they're more color stable, and, you know, once they're in there, that's what they're going to be.
How long do they last? Sorry.
Well, they can, you know, officially the ADA would say that I should say, you know, 12 to 15 to 18 years. Porcelain veneers have been around for about 20 plus years now. I have cases I did in the early to mid 80s that are still going strong, and I don't expect to suddenly start falling apart.
Great, so you take care of your team. Let's look at the procedure, and you can tell us a little bit about what you did with Joanne and giving her this beautiful bright smile.
Okay, what we're doing here is there's a lot of pre-planning that goes into these cases. So we've done an imaging for her to see what's possible. We have done a mock-up for her on models of her teeth so that she can see, we can see what's possible, she can see what's possible, and once we decide on exactly what we're going to do on tooth shapes and sizes and inclinations and those sorts of things, then we go to the mouth. And as we do that, we basically need to create room in the mouth for the porcelain, so that you don't walk around in the end with oversized teeth. You see a lot of, you know, big, bulky, white, what I call, you know, over-contoured teeth that people complain about.
How many teeth did you do, Dr. Gorman?
In Joanne's case, we did 12 teeth on the upper and 8 on the lower.
So almost a full mouth, a visible mouth, right?
Yes. Yeah, and her visible smile, that's really what we took care of.
How long did all that take?
2 visits, longer visits. We had her at the office for about 6 hours the first day, and the second day about 5. We incorporate some conscious sedation in there. That really helped out.
I was going to ask about that. So you didn't feel, you were feeling okay?
I was so comfortable that I actually fell asleep in the chair. Now, as a retired dental assistant, that's very unusual because I knew what he was doing. But he did a wonderful job. I was very comfortable and relaxed, and no pain.
So you knew what the procedure was going to involve, so you just gave into it, relaxed? And,
yes.
And what did you refer to that as, the type of sedation that Joanne had?
It's conscious sedation. It's oral sedation. In her case, we used a mild version just to take some anxiety away. And
drugs!
The biggest benefit
gentle ones.
Is it helps the time go by.
Yeah.
And so you're not as aware of, you know, all the things going on.
Let's do the before and after. Let's take a look at this right now. I'm plumb fascinated by it. There's the before. All right. And there you are now. Boy,
Oh, I love it.
remarkable results.
do look
Well, you're
really
just
natural.
beautiful anyway. It's just it's
Oh,
great. You
thank
have a
you.
great smile, so it
Thank
really
you,
enhanced
Pat.
that. So that's just wonderful. Well, thank you, Joanne Hopkins. You're just gorgeous.
Pat, I love you. Thank you.
And I've never seen your boy so silent.
I know, isn't it amazing?
Dr. Gorman, thank you for being here.
Thank you
Really
very
interesting procedures.
Thank you.
There is a lot of good stuff out there. For more makeover idea information, log on to KARE11.com and click on the Today Show, and there's all that you can access.